Hey Focus fans, it's Alex Worley. I am joined by our Empowerista this week, Dr. Pari. She's an OBGYN and she's a media contributor on women's health. So we have so much to ask you. I'm so excited you're here. Thanks for joining me.
Thank you so much for having me. I'm really excited about the interview.
Oh, good. A lot of women come up to you like at parties and that kind of thing, and I'm sure friends are texting and calling you all the time with their biggest questions. What are some of those biggest questions?
It's birth control. That's something that, a lot of times people are asking, what is the best birth control for me? I think that with, people in our age group and millennial generation, something that often gets overlooked is long-term birth control. People know about the pill, they know about NuvaRing, and of course they know about condoms, barrier methods. But something that they don't really look into is like an IUD, which is an intrauterine device, or there's also something that's called a subdermal implant that goes in your arm. And these are great options for active women that might forget to take a pill or forget to put their NuvaRing in.
I'm not gonna lie, that sounds kind of scary though. Like putting something in my arm, my first reaction is no thank you. So please speak to that. Is it as scary as it sounds?
It's actually not. It does, I agree, it has that little bit of like sci-fi type feeling to it. But no, it's, the one in the arm, it's actually a very easy insert. If it is something that, if you can tolerate a shot, you can actually tolerate the insertion.
Oh, wow.
So it's pretty simple. You get numbed under the skin and then it's in within a couple of minutes.
Oh, wow. And what about the IUD?
So IUD does tend to be a little bit more invasive because that is something that's going into your uterus. But there are options where 3 years, 5 years, 10 years, there's hormonal and non-hormonal options. And so again, it is something that might be uncomfortable in terms of insertion, but if you get used to it, think about, you have this longevity where you don't have to think about birth control. So it might become something that is worth it for you.
And I know some of my friends who have looked into that have been a little fearful about, okay, could this puncture a fallopian tube or, affect my fertility, but is that the case?
So, there are risks to every procedure, right? So there is some risk with IUD insertion. One could be that it actually would puncture your uterus. Again, this is something that is extremely rare, okay? The majority of times that, is not gonna occur. In terms of fertility, no, and that's a great question because people ask that about all types of birth control. If I'm on birth control, will it affect my fertility in the future? I.e., I had a friend that was on the birth control pill and she got off and then she could never get pregnant. The truth is there is no long-term effects.
So I think I'm speaking on behalf of a lot of ambitious Empoweristas when I say someday I want to have kids, but not yet. But I don't, of course, want to miss my window of time. So when does that window of time kind of approach?
So this is another one of the most common questions I get from patients, friends. A lot of women, like you said, are, empowered and thinking about other things and wanting to still have children, but also focus on their careers and education. So it is something that is important. And it is important to know that around the age of 32, your fertility will start to decrease a little bit, okay? When you hit 35, that's actually where it'll start to decrease a little further. And also that's what we consider advanced maternal age, okay? This is where you also start to become higher risk in terms of pregnancies.
And what does that mean exactly?
So you're at higher risk for miscarriage at that point. You're also at a higher risk for chromosomal abnormalities such as Down syndrome, okay? And then you become higher risk for different types of complications in pregnancy as well. And so that's kind of, the number that we say, okay, this might be where you kind of need to start definitely hurrying up and taking these things into consideration. As you get closer to 40, unfortunately, it's going to start to kind of take a nosedive in terms of fertility, and risk starts to really go up in terms of chromosomal problems. So, it's something that what I tell people is you don't want to live in fear, right? You don't want to be like, oh my gosh, let me scrounge, let me grab somebody, let me have a baby. You don't want to necessarily do that, but at the same time, you don't want to be naive about the fact that there are these risks there. It is something that you need to be thinking about in terms of your long-term plans.
Yeah, I mean, like you said, you don't want to just grab somebody at the bar and be like, oh, you look like you have good genes.
Right,
let's get to business. Because that's a really big decision to decide who you want to pair it with. So that's not a process I think anyone should rush. So what happens for the girl who's in her 30s who hasn't found the right person yet to parent with? What are some options potentially for her if she does want to have kids? Because, by the way, not every woman wants to have kids. kids. But if she does and hasn't found the right person yet, and she's kind of approaching that late 30s age, what's the answer for her?
So, again, it's all about figuring out what is right for you, right? So I personally am in that position as well, so I can speak.
So tell us, what are you doing?
I can speak, as a physician, and I can speak as someone in that position. There are, some options. I don't know if you've heard, but, egg freezing is one of them.
Right.
Okay?
Is that a good option?
So it is an option. Right now, the American College of OBGYN, which is, our big college that we kind of take our guidelines from when we discuss things with patients, isn't necessarily recommending egg freezing just for people that are getting older, okay? Because there are risks to it. It is a procedure that's could potentially have complications. And there are also, when you thaw the eggs when it's time, it's not 100%. So it's just something that you need to think about, are also going to have risk and kind of weigh your risk benefits, right? If, like I said, I like to talk about things personally. I personally am not somebody who's doing that.
Right.
But again, I know a lot of people that do, and it feels like a comfortable choice for them. So, it is an option. Other than that,
Adoption, right?
Exactly.
Probably could get a surrogate.
Of course, yeah. So if you were in a situation where you were getting older and you realized that you did have fertility issues, well, then that's the point where you would talk to a fertility specialist. There's options like IVF, there's egg donation, surrogacy. I mean, these are all different options if you were to get to that point.
So basically, if you were to be in that situation, don't lose hope. There are options.
Of course. I mean, there is a complete specialty past OBGYN that's called reproductive endocrinology and infertility, that this is all they do, is fertility, options.
Yeah. Well, even I have some friends who are in their low 30s, and I think there was this expectation that just got off birth control, in 2 weeks I'll be pregnant. But it can even take, in your low 30s or younger, I'm sure, longer than you would think, right?
Exactly. So one thing that people don't realize is it actually can take 1 year to get pregnant for a normal couple. And actually that's still considered normal. That's something that people, if you are out there and you are trying to get pregnant and it's been 2 months or 3 months and you're like, oh my gosh, I'm not getting pregnant, something's wrong with us. It actually can take a full year and it still be normal. Now, if you are 35 or over, you should only wait about 6 months. And then about the 6-month mark, if you're not pregnant, you should see a doctor.
Interesting. Any other questions that are coming to mind that you get asked all the time?
I get asked a lot about the birth control, a lot about the fertility stuff. I think, something else that I get asked a lot is, how often should I be seeing a gynecologist? Definitely once a year, you should be getting an exam. That is a pelvic exam, either by a gynecologist or a family practice doctor, but someone needs to be doing that exam. I think we all have a tendency not to go to the doctor unless something's wrong or we think something's wrong, but you need to be getting those annual checkups.
So even if you're married and have been with the same partner for years,
yes,
still once a year.
Yes, still once a year. Now, if you are on the other end and you're having, new sexual partners, every single time you have a new sexual partner, you should see a doctor and get checked for STDs, okay? But even if you're in a monogamous relationship, once a year you should be going to the gynecologist.
So everybody should check out her blog. It's amazing. And what I love is you incorporate a lot of pop culture and celebrity talk and their fertility. And one thing that you've talked about before is how celebrities are really raising awareness about miscarriages in particular. Tell me a little bit about that.
Yeah, so I think it's one thing that's been really great lately is that you'll see, a lot of celebrities recently speaking out about these topics personally in terms of miscarriages and fertility. And I think that it's great that, they are bringing awareness to this.
It normalizes it a little bit. It's not so taboo because a lot of times people aren't going to be talking about those things.
Exactly.
But if a celebrity is, like Chrissy Teigen comes to mind, or Tyra Banks, then it's like, oh, okay, this is a comfortable conversation, right?
Right, exactly. And I remember watching Juliana Rancic when she had all of her fertility issues and she totally publicized it on the show, and I thought, wow, this is great for people to be able to see this, because even, amongst friends, you'll see that, miscarriages are very common. It's really about 1 in 4 pregnancies will end in a miscarriage. And if you think about it, you don't know 1 in 4 people that have said, hi, I've had a miscarriage.
Yeah, because it's not something you wear a name tag saying hi, I just had a miscarriage. It's more taboo until more recently.
Yes, exactly. And I think it's great. that people are speaking out about it, and it's, you know, again, bringing that awareness and making people feel more like, hey, you know, I'm not the only one out there that might have experienced something like this.
And real quick, what is your definition of empowerment?
So I think my definition of empowerment, you know, let me relate it to the medical field. I'm going to say for women that want to be empowered, own your health. Own your health and own your body. It's your body. So learn about it, educate yourself, and ask questions.
Be proactive.
Yes.
Awesome. Thank you so much.
Thank you.
And let us know what your definition of empowerment is by using hashtag Empowerista on social media, and we'll show you some love.